Welcome to the December 9th, 2020 Grafton Board of Health meeting. Thank you everyone for joining. First off, as a preliminary matter, this is Karyn Clark, Chair of the Grafton Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Board of Health members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnet. Can see you, Austin. Can't hear you. If you're talking, Austin, we can't hear you. Can see you though. I know you're traveling and trying to call in. Josh Briggs.
Did you hear me?
Is that you, Austin? Nope.
Karyn, this is Josh Briggs. Can you hear me?
Now I can.
Okay, it's Josh Briggs, all of it.
All right. Did you respond, Dr. Muller? I
hadn't yet, but I
okay. Yeah. Can hear you. That's good. I just had a note that my computer just showed up internet connections unstable, so hopefully it's a minor blip and doesn't continue. Staff and anticipated speakers on the agenda for the topics. When I call your name, please respond in the affirmative. Nancy Connors. Pretty sure she had a commitment that she's going to join as soon as she can once she's done. Let's see. Then Karyn Clark from the Alliance. I know Dr. Michael Hirsch from the Alliance was a possibility. Pat Bruckman from the Alliance.
I'm here, Karyn. Thank you.
Hi, thanks for joining. Julie Van Arslan from the Alliance.
I'm here. Thank you.
Hi. Danielle Edmands from the Alliance.
I'm here, Karyn.
Hi, Danielle. Thanks for joining. Marianne DeVries from the MRC.
I'm here, Karyn.
Hi. And Pam Riordan from CERT. All right. So I would like to open the meeting. Board of Health members, can I get a motion to open the meeting?
This is Dan Finn. I move to open this meeting.
And is there a second?
Second.
That was Dr. Muller.
Yes.
All right. And then all in favor and individually roll call. Dan Finn.
Dan Finn, aye.
Austin Magnet. We still can't hear you, Austin. I'll send him a note, see, well, if he's only calling and that won't help. Josh Briggs.
Josh Briggs, aye.
And then Dr. Muller.
Bill Muller, aye.
And Karyn Wazowski of an aye. Josh, can you potentially text Austin? I don't know if he's driving, so I don't want him to obviously be texting and driving. Can you text him, let him know that we can't hear him? I would send it
I sure will.
Through the chat.
I will send him a text right now.
All right. All right. Actually, Colleen, just let me know. It looks like actually potentially it might be Josh. You might be showing up oddly as Austin. So, all right, we shall proceed. So thank you, everyone. Good evening. This open meeting of the Grafton Board of Health is being conducted remotely and consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we've been advised and directed by the Commonwealth to suspend public gatherings, and as such, and I'll stop right after this. As such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. And I totally blew past the select board members because I was on the second page of my notes for who to ask if was here. Sorry about that. So Peter Carlson. And then Colleen Roy.
Roy, present.
Doreen DeFazio.
Doreen DeFazio, present.
Ed Prisby.
Here.
And Matt Offen. All right.
Madam Chair, permit me to say Peter Carlson is present. Sorry.
No worry, I blew right past all 5 of you. My notes. So back to my spiel. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. According to the agenda, there are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you broadcast may be captured by said recording. All supporting materials have been provided to members of the Board of Health. Are available on the town's website unless otherwise noted. Public is encouraged to follow along using the posted agenda unless I note otherwise. It sounds like someone or a few people may not be on mute, and I'm getting some background noise. Thank you. So before we turn to the first agenda item, allow me to cover some ground rules for effective and clear conduct of our business and ensure accurate meeting minutes. I will introduce each topic and any speakers associated to that topic on the agenda. After any remarks have been concluded, go down the line of the Board of Health members, inviting each by name to provide any comment, questions, motions. As I just mentioned, please remember to mute your phone or computer when you're not speaking. And then also please remember to speak clearly in a way that will help generate accurate minutes. For any responses, please wait until I, the chair, yields the floor to you and then state your name before speaking. If members wish to engage with any other members, please do so through me, the chair, taking care to identify yourself. And then finally, each vote, if there are any votes taken during this meeting, will be conducted by a roll call vote, as is the norm with the remote meetings. So all of that being said, let's get going on the first topic for our meeting, which is the select board has been nice enough to join us. And so we can continue the conversations from last Tuesday's meeting, which I was sad that I had to miss, regarding COVID-19 updates. And with that, let me just double check to make sure no one else has joined us. I'm just going to kick it off with just the kind of standard update at the beginning, which is what we always cover, which is the case counts, et cetera. So as of December 9th, today, we've been informed of a total of 395 confirmed positive cases since we started tracking them back in March. As of the December 8th report that the Board of Health received from the school department, there have been a total of 49 cases that had been tracked since the schools had started back. As of December 3rd, Grafton is still at a yellow status per the state. The next weekly report will be tomorrow evening. They usually come out around 5 p.m., depending on how the state does with getting all the data compiled and published. As we're all aware, it's not just Grafton who's experiencing the unfortunate uptick in the cases. It's all the surrounding communities, the state, the country in general are seeing that type of increase. I'm not going to go through, the large part of like where the potential clusters may be, because I know that was covered during last Tuesday's meeting where we talked about like the Thanksgiving outcome, potential family clusters that they've been seeing, and even like medical staff. because I'd rather we dedicate as much time as possible to continuing the discussion. One thing I did want to bring up is that yesterday Governor Baker did announce that the state is going to be rolling back as a whole to phase 3, step 1. We were primarily as a state at step 2 of phase 3, except for certain communities that had been red for a while. And on top of that, the state did introduce a number of other restrictions and updates related to a number of various business types. All that being said, that doesn't, override the fact that all of the other requirements that are still in play, the mask order, the travel order, social distancing, stay-at-home advisory, gathering size limits for private gatherings, indoors and outdoors, the time restaurants must stop serving, et cetera, et cetera. So none of that has gone away. It's just things have gotten stricter. I don't know if, in terms of what the governor did, if someone from the Alliance wants to jump in and provide more information specific, because I know the Alliance did attend at least one of the webinars or local Board of Health / state meetings yesterday, I think afternoon, that got into some more further details around all the different restrictions that have been added or tweaked, shall we say, by the state. So I'm looking to see, let's see, Danielle, Julie, I don't see Karyn Clark yet on.
Excuse me, Karen, this is Pat Brockman. Karen is on. She had to call in. She couldn't get on the link.
Okay.
Okay,
Is she the
so
774 number maybe?
Hi, Karen. It's
Oh.
Karyn Clark.
Hi.
So I don't know if I'm on the video or how I got in. I had difficulty, but I'm here.
Well, we're glad you're here, because I'm looking around like I don't see you yet, but sometimes knowing I've had to call in before and it just shows up as phone number.
Sure, no problem. So I'm actually trying to pull up real quick the rollback information, which of course I'm not finding readily on my phone. I had it earlier.
Let me see, I'll of course see if I can grab it, because I know Nancy had sent something.
Yeah, I know we were talking about it yesterday, and then since then my inbox has become, all right, let's see. 1 minute.
All right. If you want, I have it. I can go through it.
Sure, if you don't mind, because I'm still trying to find it on my phone.
All right. So
Thanks, Karen.
you're welcome, not a problem. So statewide rollback phase 3, step 1, as mentioned, that's the whole state that's going to go back out. And then additionally, there'll be outdoor gatherings at event venues, public spaces will be limited to 50 people. Outdoor theaters and performance venues will be limited to 25% capacity, no more than 50 people. It mentions closing indoor theaters and performance venues and smaller indoor recreation businesses like roller rinks, trampoline parks. They're going to reduce capacity from 50% to 40% for a variety of industry sectors, such as arcades, indoor and outdoor recreational businesses. So think maybe like bowling alleys, driving and flight schools, gyms and health clubs, libraries, museums, retail, office locations, places of worship, lodging common areas, golf and movie theaters can have no more than 50 people per theater. A couple other venue protocol updates. With that, now you have to wear a mask, and this is all effective Sunday at 12:01 a.m. You have to wear a mask at all times except when eating and drinking. So at first, when you looked at that face value, it's like, well, that's what we always had to do, but it's actually different. So anytime you're not eating or drinking, you have to have the mask on. It's not just you walk to your table, you sit down, you can take your mask off for your whole meal unless you get up to go to the bathroom or walk someplace. So now it's supposed to be anytime you do not have pretty much food or drink going into your mouth, you need to have your mask on. You can see no more than 6 per table, so rolling back that way, and encouraging but not requiring customers to only dine with the same household. They're going to put a 90-minute time limit on tables, no food court seating, and then prohibiting all musical performances at restaurants at this point. So it does not limit, doesn't say specific to singing only or anything. It's just saying all musical performances are prohibited now at restaurants. Then workplaces and fitness centers were the other places that they called out in the release. They said for those, you have to wear your mask in offices when you're not in your own workspace and alone. Masks must be worn at all times in gyms, and then encouraging teleworking. And then they provided links to all of the sector-specific guidances also that can be referred to. All right, so that was the biggest update that came through yesterday. I think a lot of people were expecting / hoping, honestly, that the governor would do something, seeing how the whole state has been going in this direction. So I know I was glad that, you know, it's always easier when it's a state level than doing a town by town patchwork where people can just say they're going to go to a different town if one town's more restrictive than the other, unless you kind of group together as a whole like region to try to do things. So besides that, I know the governments, whether it be federal or state, have been talking that people should expect Thanksgiving restrictions and guidances to be no different than what, you know, they need to be planning for Christmas and any other holidays coming up, that you should be only with your own household, gathering requirements still hold true, try not to travel, etc. So all of that still will hold true. And that we're still going to be in the midst of experiencing the outcome of what happened with Thanksgiving, with people gathering and traveling. So that they are saying, I think it's December 17th was the last I heard, that could be like, we'll call it the peak of that outcome. Today, the state did announce their phases and timing for the vaccine rollout in the state. There'll, I'm sure, be much more to come on that, because there's, you know, they have very high level kind of buckets of groups that I know I personally have questions on what they mean when they say a certain type of area. Does that mean every single person that lives or works in that building gets it at that point in time, or is it going to be more detailed as time goes on? So I'm sure there'll be more coming out with that, especially for the phase 1 that's coming up very shortly. Hopefully that rollout will be happening. So more to come. I'm sure that we'll be learning shortly about how that vaccine rollout will happen for everyone, especially in phase 1. So with that, I guess I'll just toss it over to Karyn Clark. Did I miss anything big that I might not have caught during one of the governor's press conferences, or did I pretty much?
Oh, you were fantastic. No, you hit on everything. Thanks for just stepping everybody through all of the nuances of rolling back to step 1. Worcester has been staying in phase 1 all along, even when we had the opportunity to go into step 2. The metrics that continue to change colors. I think if it was still the way that it was, some of our communities would be like crimson, red, or fuchsia at this point. We know that, you know, some of the changes in those metrics are due to, you know, trying to support in-person learning with schools. And we all understand, you know, the concern around social emotional learning and all of those things. But, you know, the numbers are the numbers. Pat's our guru on all things COVID, can kind of give you all really a better sense of the landscape of what's happening in Grafton, in particular with any school cases. We're certainly seeing our share of youth in the city that are positive. So yeah, I think you hit on everything, Karyn. I can tell you that Nancy and I shared an exchange that we were absolutely elated to see that Governor Baker rolled back for everything across the state. I know from the conversation that we had last week with our two boards together that there was some initial dialogue about, you know, what should, if anything, Grafton or other communities consider doing given the uptick. So to your point, Karyn, I think it's always very helpful when it comes from the top and it's done the way that it is. I know that Governor Baker did not want to probably do this, but we're very happy that he did. So I think, you know, these additional restrictions will really just help to limit, you know, gathering sizes, and that hopefully will help limit the virus transmission. And also regarding the vaccine, I was on a statewide call actually at the same time the governor was on, so I was trying to listen to both, but there are very, like you said, Karyn, sort of these high level buckets of kind of who's going to get the vaccine when. But all of this, of course, depends on how much vaccine comes out and when it comes out. It's a very fluid situation. So we do have a link that was put up on Mass DPH after the governor's announcement about the vaccine that we can share with all of you that does sort of just break it out. I think it's a slide, like it sort of just shows the 3 buckets, but it's really going to be you know, frontline healthcare workers essentially in the beginning. They're very concerned about making sure that seniors and staff in long-term care facilities get it, which we fully support because we all saw, you know, in the first wave, how awful that was, that it was wiping out a lot of these facilities. And then I believe, you know, we'll be able to probably vaccinate, I'm hoping, the masses of our residents. I'm hoping by, you know, April. But we're still not totally clear on what exactly the role of local public health is going to be. From preliminary conversations, it sounds like a lot of the vaccine is going to go to healthcare centers, hospitals, and pharmacies, which have taken the lift off of local public health for a number of years now, even around the flu vaccine. You know, I remember the days when we used to have lines of people coming for flu vaccine, and now that's not happening because they get it sooner than we can, and it's just convenient for people to go to pharmacies. So there will be some role for us. You know, we just are still sort of waiting to hear from Mass DPH exactly what that's all going to look like. But at the same time, we're all still looking at how do we sort of dust off our emergency dispensing site plans and just make sure that we are ready for whatever's going to come our way. So it's definitely exciting to even talk about a vaccine. I think we all just feel a little rejuvenated by that. But there's still a lot that's going to come, and we'll continue to have conversations and think about how we're going to do all of this together.
Agreed. Well, thank you, Karyn. Pat,
Sure.
do you want to provide anything more on the cases? Any insights you've seen?
Yeah. Hello, Karyn. Thank you. One thing I just am like, yeah, I am tired. I'm trying to do an analysis for every town of when, you know, school cases, when they, you know, from the typical start of school, you know, breaking it out by age from the daycare age, pre-K 3 and 4, elementary school, middle school, high school. Unfortunately, that is very labor intensive, simply because, you know, Maven is Maven, as I can, you know, can say. So it is labor intensive. I am trying to do that for every town, but again, it's a slow haul in between calls and contact tracing, et cetera. The only good thing I can say is at least we're not seeing a lot of in-school transmission, fortunately. But again, the rate of asymptomatic transmission out in the community is much, much higher than we have seen in the past. Jackie and I are talking, she's at the point of emailing me, and that is getting a little bit difficult simply because my email is clogged. But I'm glad to say that we don't see a lot of in-school transmission in the towns. And you did say you had 45 cases they'd contact traced in the towns, in Grafton. I'm hoping that it remains that way, but what we're seeing a lot in the community, in all communities, is the fact that if one person in the family gets it, everybody gets it. It's the rarity that we see somebody in a family that actually doesn't get it. We've pretty much are seeing it run through a whole family when you do have a case. I hope by next meeting to have a really in-depth analysis for you of all of the ages and whatever. Daycares in all of the Alliance communities are getting hit. Grafton is no exception to that. Businesses, it's across the board. As I was saying this morning on a call, this is an equal opportunity infector. It doesn't, we've had cases as young as 3 weeks old and 102 years old, not necessarily in Grafton, but what we've seen throughout the whole pandemic. So it doesn't discriminate against, any particular group. I mean, we're seeing it everywhere. I mean, as Karyn said early on, our nursing homes were being devastated. Again, we're seeing some upticks in the nursing homes, in the group homes, daycares, et cetera. And, in the Grafton school system, but 45 cases, fortunately, is, less than we would be seeing if we had in-school spread. Thank you.
Thank you. All right, so next I wanted to jump into some of the questions that came out that Dan had taken back following Tuesday's meeting that we were going to bring back for, well, originally Monday, now tonight, for further discussion. So the first one was, I think there was a question around what more can the select board do to assist the Board of Health during COVID? And so I had, mentioned these to the other Board of Health members, because obviously I wanted folks to come to the meeting with any ideas that they had. So I'd open up, Dan, I don't know if you.
Sure. This is Dan Finn. Thank you, Karyn. First I'd like to thank the select board for their interest and offer to assist us. It's been a pretty overwhelming year, actually, for everybody on everything, but we appreciate that. And I think personally, certainly a little earlier in the year, we had a couple of situations that we could have used some help in terms of dealing with repeat offenders and local personalities and things like that. At this point, it might be water over the dam, under the bridge on most of those cases. But if we could just hear, before we get into it too much more, if we could hear from Julie or Karyn C, just get an update of where we stand in terms of inspections. Are there any current issues? I know, without going through the whole Alliance update, could someone talk about that?
Yeah, so I actually had asked Nancy if she could put together a spreadsheet. I don't know how she's been tracking, because it's more Julie and Phil or Danielle that are really working hand in glove with her on any follow-up. But I didn't get anything from Nancy. I think I heard she may have left early today, but I think it would be helpful get that to you. I apologize, we don't have it at the moment, but I think it would be helpful for the board and the Board of Selectmen to just see it in terms of types of, complaints or violations, any action taken, et cetera. So, Julie, if you, or Danielle, if either of you could just sort of step us through maybe the last couple of weeks of sort of general complaints or things that you've specifically followed up on and what the outcome was, that would be really helpful.
And this is just Karen quickly. Nancy had a unexpected appointment that she had to go to. She had to leave mid-afternoon.
Sure, no
Unmuted.
worries. That's what I heard.
Hi, this is Danielle. I can definitely do that
I'm
for
gonna
you.
let Danielle speak to it, and then I'm gonna do a follow-up to what she's saying.
No, my camera's not on.
Perfect. Thanks, Julie. So yes, actually for the last few weeks, Grafton really hasn't had a lot of specific COVID complaints. But I know, for example, we've actually only had to fine one establishment due to consistent COVID complaints. And once that fine was issued and paid for, they have been stellar. And I've done a couple drop-ins since, and they've been compliant. But lately, when I'm not complaining, we haven't had a lot of COVID-related complaints in Grafton lately. Everyone's been pretty much behaving.
Through the chair?
Yes.
Hi.
Hi.
So I just wanted to add a few more comments to, what Danielle is saying. Actually, Grafton is really behaving right now, and they seem to be the ones that the complaints are not coming through. But I'm not sure if the Board of Selectmen realize that normally what's been transpiring is not only are we getting complaints from the general public, but also we do receive complaints from the Department of Labor Standards, as well as the Attorney General's office, which we do follow up on as well. One of the most interesting pieces of information that I was able to obtain last night, because I was trying to see if the Department of Labor would come out and assist in a different community on a different case. I was kind of a little surprised to find out that they only have 12 inspectors for the entire Commonwealth. So they don't have the ability to actually be boots on the ground like we are. And I think that, the other big thing too is if the Board of Selectmen was not aware, not only do we handle all of our day-to-day stuff, all of our routine as well as COVID complaints, but also we now have to follow up on any complaints that come through any commercial business. And again, as far as we go, we also help and we try to help assist Pat and Amelia, again, to be the boots on the ground to help, get some information as it is needed. So that way, Pat and Amelia will be able to finish up their, information and then enter stuff into Maven. But, your office has been quite busy. And fortunately, it's not due to COVID complaints at this time, knock on wood. And another interesting fact is that when the governor is rolling back to phase 3, step 1, one of the questions that I had actually emailed DPH is, so on December 13th, moving forward, if there's a community in the red for 3 weeks, what do we do? Do we roll back to phase 2, step, I don't know, or are we staying at phase 3, phase 3, step 1? Once I receive that information, I will forward along to the board, and that way you could forward along to the Board of Selectmen, because that would be some interesting information.
Karen, excuse me.
Dan?
Yeah, this is Dan. Thanks, ladies. And I don't know if the board, the select board individually have any questions for us or for the Alliance.
Ed?
Yeah, thanks, guys. Thanks for the update. Thanks for being here tonight and agreeing to meet with us on relatively short notice. A lot of this information obviously is helpful to us. You know, the people in this meeting and the people that have thought to log in here tonight obviously are among the few less than 50 people who are high information residents. And I think one of the challenges that we face, not only as a community, but in our individual roles here as either Board of Health members and Select Board members, is how can we use our positions to best inform people about what's going on. I think we've gotten, from my view as a Select Board member, I think we've gotten better at that as time has gone on. I think for a little bit of time there was a disconnect between information that was coming into the town administrator's office and stuff that was coming to us or stuff that was coming to the school department. That's improved. I think that we've gotten a little bit better in case reporting. I'll tell you that some of the questions that I was getting at first I couldn't answer, such as specific data on ages of people that were being diagnosed with COVID-19, people that have died from it. And, you know, this is all data that for whatever reason is important to people in the community to have, so they can then assess for themselves their own risk factor and their own risk tolerance. So I understand that. I think that we've gotten better at doing that. I think one of the things that I have been concerned about, and one of the reasons I was interested in meeting with you guys today, is because we've got licenses coming up that we have to renew for commercial establishments. And I have been concerned over the course of the past 4 or 5 months about establishments that are simply ignoring the state's guidelines for safe practices, such as, you know, staff that aren't wearing masks, owners that aren't wearing masks, entertainment that's too close to customers, etc. And I know from casual conversations with people in this meeting that has been happening and that has been repeated. And some of the offenders are not simply ignorant, but are actually thumbing their noses at these regulations and saying things like, I got to put food on my table. So as the cases increase and the state guidelines get stricter about entertainment and about food and about masks, now we're going to have to wear masks at tables inside restaurants. I'm curious as to who's going to enforce that, what the steps are for levying some kind of penalty with teeth, and how we can help with that. Because I think the only thing that we're empowered to do under the law is to deny an entertainment license. And the reason you could do that is because under the statute, it allows you to assess whether or not issuing the entertainment license has some deleterious impact on the health, safety, and welfare of the community. So for instance, I got another email tonight about a local establishment about noise. Okay, it's noise. I'm probably not inclined not to entertain somebody, or not to give somebody an entertainment license because of noise. But I will very seriously argue not to give somebody an entertainment license the next time I find out that somebody has thumbed their nose at the Board of Health or at the Health Alliance about enforcement, because that puts people's lives at risk. Everybody's got food to put on the table, but health, safety, and welfare of the paying customer in the community comes first. And I think that's got to be a message coming from the Board of Health, and that's got to be a message coming from us. So if there is something that we can do to further that, I'm all ears. I know, and frankly, I don't know how candid you want to be with this conversation. I know there's a list of violators. I've seen it. I've read it. I know who they are. Okay. And I don't know if you want to talk about that. I don't know if you want to say the guidelines have been rolled back. We're comfortable with the education we've given people. We're comfortable with where everybody's at, given their behavior over the past couple months. If that's the case, then okay. But over the past couple months, the guidelines have been pretty lax. Now we're coming to a point where past offenders are going to be asked now, specifically in restaurants, to police mask wearing of their paying customers, which is uncomfortable. So I guess I'm curious as to how we can help with the enforcement insofar as entertainment licenses go.
Board of Health members. comments? I wouldn't want,
So,
or I say, or Karyn, you see this across more communities than just Grafton. I guess that would be
yeah,
probably
so
best to get your insight first.
Sure, Karen, thank you. So, and I would just kind of, I'm gonna have Julie, as an enforcement agent, sort of step through what the process would be for, enforcement from education to issuing a fine. There's a process there. So I think, depending on what is going on with these particular establishments, I don't know that you can just jump to pulling someone's license. I think there still has to be a process that you follow. Not as
Well, if I could just interject there for a second, these licenses are coming up for renewal. So
Yep.
we're not having a hearing to pull anything, but one of the things that we are empowered to consider when somebody is reapplying for that sort of thing is whether or not we want to reissue it. So each one of these comes to us basically de novo, which is it's a new application and we're considering the application. And one of the things that we get to consider is health, safety, and welfare.
Right, I understand that, and thank you for calling that out. I don't have enough information. I only know the process on the Board of Health side, if there's a violation. I don't know, if there's been something egregious enough from the Board of Health side and the work that we do for the town as the health agent, that would flag something that would be up for renewal in front of the Board of Selectmen. I also think you would want to inquire with town council about that piece. We're dealing with a lot of similar issues in Worcester. We've got an interdepartmental COVID enforcement team. I've gone out at night. Dr. Castile, our Commissioner of Health and Human Services, we've gone out with the police, code enforcement, folks from the food division. We visit, we've been doing spot checks, Ed, but we've also been following up on, places that we've been getting a lot of complaints about, not wearing masks, or that there was entertainment and there should have been. So we've tried to really have more of an educational approach, but we're getting a lot more aggressive but we're following first we're doing education, then we're going back and issuing, verbal warning, then it's going into writing tickets, which some people are trying to, appeal, claiming they didn't know, and so I think there's really that process that you have to build on before you sort of pull the pin. There are a few places that, like some smoking bars and some other places that were clearly not following the governor's orders, when they were supposedly operating as a restaurant, which was really all that they could do, which was sort of the bone to say, look, we know, you can't really operate as a bar, but if you have, prepared food on site, not like a bag of chips, but something that you have in a crock pot or something that you can prepare, then you can serve alcohol, and, people can't stick around for 4 hours and continue to order alcohol after they've eaten a hot dog. So, we have fined people $500, for it's very clear, but we had gone through the whole process of doing education and warnings and so forth and so on. So I'm familiar with those types of things because I've been heavily involved in it in the city of Worcester, but I don't know, Julie and Danielle, can you speak to, anything that's come in either through Nancy's phone or through DLS or all these other state agencies that have been contacting us directly with all of these complaints that they want us to follow up on? Is there anything that's been, you've issued a fine, or that you've had a hearing in front of the board, or anything like that you would flag for the Board of Selectmen?
Julie, would you like me to speak to this, Julie, or?
Julie, you must be on
Through
mute.
the chair,
Yes.
to you, it's absolutely fine. I just don't know if you can hear me. Can you hear me?
Yeah, we can now, Julie. Do you want me to speak to this or?
Okay. Yeah, you can go ahead and then I will pick up where you left off.
Okay. So like I mentioned earlier, we've only had to fine one establishment. And the process that we took with that was multiple people. Julie and myself went and spoke with the owners of the establishment. We educated, we informed, and then I believe it was either Julie or myself went and gave a verbal warning. And then after that, I was the one that went to the establishment, saw the violation and wrote the ticket. And after that ticket was issued and paid for, like I mentioned, they've been fantastic about, following the rules. So personally, I have nothing to flag for the Board of Selectmen. Julie, I don't know if you do.
Yeah. So with the town of Grafton, the complaints that are coming through, so a complaint intake form is filled out and forwarded over to us, to myself, Danielle, Phil, Karyn, and then we follow up on it. There has not been many complaints that have actually been forwarded over regarding COVID violations lately. Ones in the past, if they were repeat businesses, establishments, commercial buildings, the complaint was not always the same. So one could have been for noise, one could have been for customers not wearing masks, could have been for employees not wearing face coverings. So every time we would go in, it could be for something different. When we go in and conduct an inspection, at the time of our inspection, if the complaint's unfounded, it's unfounded, but we do talk to the person in charge. We do tell them why we're there. We do tell them what the complaint was. And then, we educate the whole way through. It's not the same, if it's the same complaint coming through and we observe it, again, we educate. Then we do a verbal warning, but also we can do written warnings. And then the place of business that Danielle's talking about, that one was issued a ticket. But normally, again, it's educating, verbal or written warning, and then ticketing. But if one establishment has different complaints about different things, usually we educate on whatever that piece is at the time. If it's not something that we see, we have to say it's unfounded at the time. So that's the hardest piece here. And as far as, perhaps maybe not renewing a license or that, I think I read at some point, anything that had to do with COVID related, I wasn't sure if, I think on that one, I would check with legal counsel just to make sure, because if it's COVID related violations that you want to withhold a renewal, I think I would just double check with legal counsel on that, because again, this is something kind of new for all of us.
All right, so I am actually a lawyer, so I can tell you I have clients who I have clients who regularly apply for entertainment licenses. In fact, I have one where we're fighting with a particular board of selectmen on the North Shore because my client's establishment allegedly is too noisy for the neighborhood, and they wanted to withhold an entertainment license. And we had to argue about whether or not that was actually a health, safety, welfare thing, or whether the noise was more than what one could reasonably expect coming from the establishment. So I'm pretty familiar with the statute. It's a little bit different than Board of Health stuff. So I appreciate, you guys have a difficult job in determining what's real and what's not, what complaints are real and what aren't, what are substantiated and what aren't. But I can tell you, again, I'm looking at this memo that's on Board of Health letterhead, and there is the place that you find $300. And I don't know who took these notes or whether or not they're complete, but the entry for the place that you find, it seemed like it was warranted that they got the fine, but I'm looking at other ones that are more serious that aren't. And, who you guys find and your enforcement, that's entirely up to you. We have no say over that. The only way we can help you, the only way that we can help deter behavior that candidly, people don't need any more education. People don't need any more warnings at this point. And we've been dealing with this for 9 months. If you don't know what to do by now, you close your doors. Okay. I'm at a point where I'm sort of out of patience for educating people about what are safe practices and what aren't. People are aware. And I'm not, as a select board member, obligated to educate people before I consider whether or not I want to vote to reissue their entertainment license. So if we want to talk about specific places that you guys have concerns about, that's how we can help you. But if we're not going to have that conversation, I don't, other than us, encouraging people to be safe and encouraging people to wear masks in restaurants, I don't know how else we can help.
So this is Karyn Clark again, if I could just comment. So Ed, I appreciate what you're saying. I can tell you that we also feel like people have been educated ad nauseum at this point. It's incredibly frustrating to be a public health person right now, or just a general resident, out seeing people not wearing masks and, just people feeling like they're doing their part, but then others aren't because they either think it's a hoax or they are sick of it or, feel like their rights are being trampled on, etc. I mean, I don't have to tell you, just turn on the news. You all know, you're seeing the same things that we're seeing. So I appreciate very much, I think we all do, the level of support and commitment from the Board of Selectmen, because it is frustrating and we do feel like it's whack-a-mole and it's nonstop all day long, chasing people around who should be following the rules and don't want to. I think what would be helpful, especially since, we're all working on this together, is to provide, which I just actually, while we were all talking, I just sent Karen and Nancy and Dan the link to the governor's order about the rollback, just because there's a lot there. And I asked Nancy if she could share that with the rest of the Board of Health and the Board of Selectmen, as well as the slide deck about vaccines. I sent that too, just so you can all be up to speed on what we learned today. I think it would be helpful if we could share with the Board of Selectmen, regular updates on the types of complaints and if they're repeat, so that we can potentially tap into that arm of, of looking at, if you're not going to play by the rules, how many times are you going to get warned before there's some action taken? So I'm not familiar enough with, what is happening on the ground there, specific entities, but I clearly hear your offer of support to say, if people are not compliant, certainly the Board of Selectmen is interested in looking at ways to, toughen up on this issue to get people to comply. And it's a gift to be able to get these licenses. So hopefully people understand that are listening that, you know, the Board of Selectmen and the Board of Health are very serious about this and are looking at all options to get people to be compliant. So I don't know if there's any, you know, specific ones that we would list out tonight. I just don't have that information, but I think we need to have an ongoing dialogue about any problem establishments that we may need the Board of Selectmen to provide support to the Board of Health on having some difficult conversations.
Yeah, I think I saw.
Can I ask,
Dan.
Karyn, can I ask you a question through you to Dan? Dan, will you be bold enough to tell us how we could have helped months ago? Like, who are the people you're talking about? What can we do? You know, I feel like we're sort of dancing around getting specific with this.
Right. Karyn, could you please ask Josh to recuse himself for a few minutes?
Yeah, Josh, if you could recuse, aka log off, and then one of us will text you when we're done.
Yep. Got it.
Thanks.
Thank you. Yeah, I guess the one that jumps out on the list here is reunion, and has caused considerable consternation for the inspection team and us as well. That being said, it seems like things have gotten better there in a number of ways and possibly will get better. And we have a short window here to take action or whatever, but it's certainly the select board's power, whatever, or interest or power to bring in a proprietor or two of any of these businesses that stand out and just have not a re-interview for the license, but just to have a conversation about how important complying with the COVID regulations and in some cases governor's orders, you know.
Well, yeah, because I mean, the current order that comes into play Sunday at 12:01 is no entertainment at this point.
That
So
might be Saturday actually, but whatever.
Well, it was it Sunday at 12:01 a.m. So come that, I mean, they have been better than previously, but we'll have to see, you know, do they comply, obviously, with the fact that you can't have anything at this point come Sunday morning.
Thank you, Dan, for being candid about that. You know, and again, I'm looking at this list, and Fancy Pizza's whacked for $300, justifiably from what I can see here. But then I'm scrolling down, and Reunion Tap and Table, band with singing inside 10, band inside 10, band members not 10 feet apart from each other, and band not 25 feet apart from first patron, band not in compliance with entertainment regulations, numerous on all the above. Owners contacted numerous times, state contacted, still not in compliance. And I don't know if they're in compliance now since the date of this memo, but that's alarming to me. And I'm not in good conscience going to say, okay, you know, you're better now reading that and vote in favor of a new entertainment license, because the best predictor of future behavior is past behavior. If somebody felt 5 months ago that having a band there was going to put food on their table, they're sure as hell going to think that in January, February. And I don't know if weather or climate is going to play a factor, but that's concerning to me.
Right.
You know, and I feel like we owe it to the general public not to come down hard on businesses, but to come down on people who just feel like they're not going to comply with this because they don't want to. And on top of it all, he's on the board.
Right. So that's been part of the, excuse me, Karyn and Ed, and that's obviously been one of the convoluted pieces of this and complicating factors is that there are personalities involved in the ownership that you know, have volunteered for the town and things like that. So it's just been difficult for everybody, I think, to enforce.
It sends entirely the wrong message at a time when we're experiencing an explosion of COVID-related cases in Grafton. To have people still sort of be like, or have been like, these rules don't apply to me, and I'm in a position to potentially enforce them against competitors even. It has stuck in my craw for a while now, and I'm glad we're having the conversation now. It needs to be had. I don't know, and my fellow board members are free to chime in. I don't know how exactly that's going to shake out with us in this question about the entertainment license, but it is sure as heck really important to me that this issue get resolved. And, again, to anybody else who runs a business within the sound of my voice, it is something that I'm going to bring up when we're talking about entertainment licenses, because I think it's squarely within our authority as a select board when we're talking about those to consider the health, safety, and welfare of the people who are going to be entertained or who want to go be entertained at these establishments.
Peter, did you want to say something? I saw you jump.
Yeah, I'm trying to, thank you, Madam Chair. So to address one of my fellow board members' concerns and, process the next steps, I think, we have to clearly differentiate between, the two types of complaints. One is, noise related and so on and so forth. That's not really technically Board of Health related or Alliance related. Some people can differ on that, but that's how I feel. But from a health and human safety perspective, and just looking at, what options are at the table, I think it's fair to ask, what are here's the first question I have here is, what are the select board's power and authority when it defines us as the licensing authority and for live music and entertainment? And if that's the case, for issuances of new or renewal, I think the question comes down to, and Mr. Prisby, you might be thinking along the same lines, but the question I have is, what authority do we have? Can we add criteria and stipulations for renewal process for live entertainment? And this would go for anybody, where go across the board, where we can say, look, we're restricting live entertainment for only indoors. Well, by the way, while you can't do that now until such restrictions are lifted, this is what we're doing, because and that handles a couple of different things, and that doesn't really address helping the Board of Health per se. But I think these are questions that we need to get answers for prior to renewal to see if there is something that we can do as a board and take that into consideration. I mean, Mr. Prisby, I don't know if that's exactly what you were going down. I don't know how the rest of the board members feels. Again, we have this on our agenda next Tuesday. I know we can't make a decision tonight on this, but that's how I feel we need to address this.
I agree with that, Peter.
If I may, I also agree, Peter. I like the idea of additional criteria that we can add. My only other question would be since entertainment is suspended right now from the governor, is there a rush to even renew that particular license at this time, or can we buy ourselves some time since they're not allowed to use it anyway?
If I may, Madam Chair, that's a great question. And I actually was thinking about that too. What happens if we let the renewals lapse? I don't know. So I think I've got to get some information to the board for you guys for next Tuesday. I'm kind of glad we're here, kind of continuing this conversation from last Tuesday, and get that to you. I'll find out.
I'm in agreement too, Mr. Chair, with the rest of the board.
Thank you.
But
Yep, Dan.
maybe wrap up and I also just want to mention another way that you folks can help us, and is just by spreading the word about the 3 W's and not just in your family, but your neighborhood and any organization you're involved with, maybe the Boy Scouts or whatever, and just try to spread the word that how important this is. I heard a pretty scary number on the way into the room here at 6:25 that there were 89 deaths in Massachusetts today. So it's real. And anyway, that's just another simple way that you can help us from a public health standpoint.
Okay.
Thanks.
Ed? Yep. Yeah.
Sorry, one more thing. There has been some confusion, and even I have it, about testing, how easy it is to get, where you should go, what you can expect in our geographic area in terms of wait times for the rapid tests. If you guys have any information about that, if you could pass it along to us, I'd love to forward that out to people.
So, Karyn, if I could just comment on that. Thanks, that's a great question. So, I think just listening to some of the questions tonight, there's a lot of stuff that we send Nancy, probably too much. So we also do a monthly update. It's nothing particularly fancy, but it's something I started about 5 years ago. We just do updates and provide information to the Alliance, town managers and boards of health every month on things that we're working on, things that are coming up. I do an admin section around stuff like this, like calling out testing. We can ask Nancy if she can share that with you guys. I think that would be helpful. One, just so you can see what we're doing in town or around these issues, but also for COVID, because there is so much information. So that way you'll be in lockstep with the board on any stuff that we send out. But just for right now, I'll just share. So the state Department of Public Health has been sponsoring these Stop the Spread testing sites, which are actually open to any Massachusetts resident. You can go to any of them. If you go on mass.gov and look at the Stop the Spread link, every single location in terms of community and street or who the provider is listed. Worcester has been doing this for quite some time. I think that's one that's probably closest to all of you to go to. UMass Memorial has been doing a lot of testing. They've been doing about 1,000 tests a day. About 40% of the folks who utilize that free testing site are not from Worcester. So people are definitely coming there to use the service. AIDS Project Worcester actually has a site that they've been operating as well. They're going to be doing this until the end of December. We just found out, I think it was yesterday, that the UMass site is going to be going through the end of March. Obviously, testing is super important, and we want to encourage people to do that and give them resources. I did talk to the state today and raise my concern that once AIDS Project Worcester site is done, we're only going to be down to one. And I asked if there was plans to get another provider to help with that. And I would say, Pat, and correct me if I'm wrong, would you say right now it's about 24 hours or so that people are getting their test results?
The test results through UMass and AIDS Project Worcester through the Broad are coming in some instances within 18 to 24 hours. Other testing sites are coming in much later. I've seen some tests coming in lately from odd testing sites that are, 5-6 days delayed. So most certainly the Stop the Spread sites are probably getting you your test results much, much faster than other sites. But for the most part, the majority of non-Stop the Spread sites are about 48 to 72 hours max. We have those outliers, but that's the exception.
So I think, Ed, the Stop the Spread stuff should be on the town website, but certainly if it isn't, we can work with whoever to get that on there. Certainly social media. We also did some flu and COVID PSAs that we sent that I can talk with Carter and ask him if those are up on your local cable. They can also be used on social media. So we're trying to, feed information as we get it and just try to give as much as we can so people can get whatever resources they need.
Dan, did
Thank you. That's very helpful.
Sure, of course.
Yes, thanks, Karyn. Just one last thing for the select board, and then they can go have their supper, maybe. But I was on the conference call today with Sunshine Sign, a couple ladies from there, and Nancy. And they're going to give us some proposals on some a mask up campaign of signs that hopefully can be paid for from the care funds that are available. And so I think we'll probably want to reach out to the select board just for ideas of where to put them and what they're like. But one good idea was to have a standard plexiglass sign, you know, on a front door entrance of a business and provide it for free and put a different insert in there. Right now it's basically mask up, but it would have the Grafton logo or something on it. But to standardize that as opposed to going into different stores and seeing 3 different signs, and also as we go forward, because this is going to go on for 3 or 4 months with updates, and we'd be able to slide in a different type of message to try to get it out there. And there's a couple other ideas too about, you know, like maybe changing the banners that say Happy Holidays to something regarding reminders. But if you don't mind, the select board members, I think we'll be reaching out to you for ideas, and then how to actually do that, whether we'd have to go to a planning board to have a sign and the process of all of that. So I just wanted to mention that's kind of in the works too, if we pursue it. And thank you for coming, everybody.
Do any of the select, I would say, Colin, do you have anyone else have any questions from the select board before?
So I just have a quick question about the schools. The Framingham superintendent is claiming that they have evidence of spread within the schools. Are you guys following that at all? And you know what triggers they're identifying so we can identify them in our schools?
Pat probably is the best one. It's
Okay.
near and dear to her.
Okay, so through the chair, thank you for that question. I am unfortunately not following Framingham at all. I am doing 12 hours a day of COVID calls, COVID emails, following up with everyone. So I'm not familiar with that. I have not seen a complete news report in a year because we've been doing this for a year in Worcester with travelers and such. But I will say, when we're looking for spread in schools, we're looking at identified cases in schools and determining if any of their we're looking at the identified case in the school and anyone who's been dismissed from school as a close contact and identified as a close contact in the school. And we're not seeing spread for the most part within our schools. Again, looking at identified close contacts in each of the grades and whatever, or on the bus or whatever, or a sports team, etc. We're not seeing that. Most certainly, if we do start seeing that, we will, there are some rapid response teams and whatever that can be put into place if that particular school meets the criteria for that rapid response team. But right now, we are not seeing that in the schools for the most part in the Alliance.
Karen, if I may again, try to make a last point. I did happen to speak with Superintendent Cummings, Jay Cummings today, and he mentioned that the superintendents in the Southern Worcester County League have decided to postpone winter sports at least through the holidays and take it up again in this discussion in January, and they might be looking for our input. But he said they're closely watching the spread in the schools, and they're apparently not concerned enough to go completely remote at this time. I can't really speak for him, but that's what the gist of what I got.
Right. Doreen, did you have your hand up?
Yeah, thanks, Madam Chair. Just a quick question relating to town halls. And so, as you know, back in March, when we first entered shutdown, town hall was closed, and it opened back up to staff, and then it opened back up to the public as well with appointments. So at this time, I'm just curious how the Board of Health feels, or how the Alliance feels about keeping town halls open to the public. Are towns making their own decision on that? We have right now staggered employees that are working remote in one office and then home. But we're still allowing, the public to come in with masks on. And so as we roll back to phase 3, step 1, I was just wondering if there was any opinion on that, or if there were other communities that were making decisions based on allowing public in their town hall. Or anything, I guess the last thing I'll add is anything else that we could do to keep, staff safe, as we do for the school. So obviously people aren't allowed, public isn't allowed in the school. It's the children and the teachers, the staff. So that's my concern with the municipal side.
I can speak to Grafton. I know Carter had reached out. I think, Peter, you were on the back and forth also, asking opinions on, and this was before the state did any type of rollback. So a couple days ago, asking, his thought was, at least at the time, last he and I spoke, was if and when Grafton went red for a status, his thought was to shut down the town hall, municipal center to any public at that point in time. I also mentioned, potentially thinking about rolling back on how many employees or the frequency of employees in the town hall at the time. I know his response was that he was working with council to see, what the best next steps would be. That was the last I'd heard from, but like I said, that was prior to any type of state rollback. I don't know, Karyn or anyone in the Alliance, if you can speak on like what other folks in the Alliance are doing at their town halls.
Yeah, or just an opinion overall too of the board and the Alliance would be great. Thank you.
Sure. So Julie and Danielle, I don't know, what you're hearing for the other communities in the Alliance. I did have a conversation yesterday with Kevin Mizikar and Kristen Loss from Grafton. They were asking kind of the same questions. They've been really good all along about having like an A and a B schedule for sort of rotating staff in 1 week and out the next, keeping the same cohort. I think they're looking at potentially just sort of looking at online or, I think they were already doing appointments, but I think they're just trying to tighten up and have less people in the town hall. We're having similar conversations with the city manager in Worcester about, because right now it's appointments only, but, we also can do online. I think we're all just sort of in the same boat. It's a great question. Obviously, it's up to each individual municipality, but it's sort of like, when do you pull the pin on doing as much remote work as you can and just also being able to continue business as usual. So I don't think there's really any, I like the idea of the, well, when we turn red, that's sort of your metric to kind of pull the pin. But at the same time, when I see the numbers that we're having in the city, it makes me uncomfortable that we're not looking at these options or doing it sooner rather than later. So I don't have like a real solid answer. I would ask Julie and Danielle if sort of what the landscape is currently, or if there's any conversations in the other town halls that you are at on a regular basis. Julie, you're on mute.
Can you hear me now?
Yep.
Okay. So in the town of Millbury, they do have appointments only, but the people, the public, the furthest point that they get is in the lobby. They have a table set up in the lobby with plexiglass barriers, and it's cleaned after each appointment is going through. They do have a staggered shift in a few of the offices there because of a number of people that are located in those offices. So part of the week they work remote, and then they rotate back and forth. The town manager has not asked yet for any recommendations through us, but all the employees want to know when they can start working remote. So it's mostly in the other communities, from my experience, they want to work remote, even though they have all the barriers up in place and the public is not walking into their offices. So I don't know if it's just a matter of feeling safer being at home or what, but again, no talk from, the town officials versus, the regular employees. The employees just want to be home.
And one thing I'll say is just knowing from the Board of Health office or Nancy's side of the world is Nancy doesn't have a laptop, which means she can only access via phone and a tablet, which means she can't get to all of her files if she is to work from home. So that's a big hiccup, obviously, considering she's working nonstop on COVID related things and licensing, et cetera. So if we were to go back fully remote, obviously that's my own personal concern from her ability to actually do her job, which is, well more than 8 hours a day at this point.
So
And
Karyn,
addressing everything.
Karyn, you can talk to Carter about this, but I think you can get her a laptop through CARES Act funding or some of the public health emergency funding, because I'm pretty sure have bought some like Surface Pros or something, because we were all remote at one point, or orbiting from the emergency operations center to Mead Street to our house. So we can certainly talk to Carter or look at some funds that came in to see how we can support her with that.
Thank you.
Yep.
Laptops were purchased for other communities too, as far as Board of Health goes through the CARES Act or from the funding that the city of Worcester provided. And I know that to be true because the ladies in the office were taking everything home to work remotely in the beginning.
Thank you. Colleen?
I was just going to circle back to the schools. Dr. Mueller looked like he was going to say something. I was really interested to hear what he was going to have to say on that topic.
Let me figure out how to unmute myself. I think one of the big issues with COVID-19 is that a fairly large percentage, 40% or more, people who are infected are totally asymptomatic. And so without doing surveillance testing, which at this point is really impractical, you have to almost assume that anyone you come into contact with could conceivably be contagious. So I think it really requires a raising of public consciousness about how prevalent it is in this community now. I think Ed is right. I think we hear a lot about this, and I think we've heard so much about it that I think we've kind of tuned it out and don't really kind of fully understand how close it is to where we reside, really. I think it would come as a surprise to a lot of our neighbors what some of these recent numbers we've been seeing from the Alliance and so forth in terms of what the prevalence is. Certainly some school systems have gone to surveillance testing. My grandchildren in Watertown are now being tested like every week or every other week or something of that sort. But that's not really practical. So I think you really have to practice what in medical terms we consider kind of universal precautions. You have to assume that everyone potentially is contagious. You have to avoid circumstances in which you put yourself at unnecessary risk. I think with the town hall, I think they likely should be working remotely. Because I don't know that there are too many circumstances in which they actually have to physically come in contact with the people that they're going to be interacting with. So if Sunshine Sign can create some signs, we obviously have that programmable thing that they put at the bottom of the hill there that always tells us a variety of different things. But I think we really need to be more proactive about at least trying to raise consciousness about this is really becoming much more of a real and present danger. And I think, unfortunately, people have been somewhat complacent about it. We went through our terrible time in the spring, and now it seems like it's really the Midwest and the West Coast and other places that are more, more severely affected. But, opening the DCU Center again for patient care is pretty emblematic of the fact that the incidence has gotten much greater.
Peter?
Thank you. Going back to Mr. Prisby's point earlier about having more information available, centrally located where people can very easily access it, and then anyone who wants to share it, we can go to one source, I think is crucial to this point. I believe adding additional statistical information over, looking at the 14-day period and looking at those rates, addressing or indicating any type of mortality that has occurred as a result for Grafton. So it really helps Grafton residents to kind of whether or not, like, is it, what they're seeking to do, is it worth the risk, is it necessary, right? So as much as we are, or the whole country is emphasizing, limit your exposure, social distance, do everything you could possibly do, and it's more of a behavior. People also make those determinations based on data, right? So obviously in the summer, the incidences were quite low. You saw a lot more freedoms, and you saw some much more, I think, relaxed type of vigilance on people. To Dr. Miller's point, as the numbers are coming in, and the fact that we've opened up a field hospital, state has opened up a field hospital in Worcester, and it's filling up rapidly. I think it's indicative that as much as I know we can go to the state website and pull that data down, I think having something that's Grafton centric is crucial. And I know we get some numbers on the, on a daily basis that shows like the number who tested positive, but it's really hard unless you've got this all stacked up. And I'll be honest with you, I'm not I don't think you want me doing that analysis, right? What if I get something wrong? But you want to be able to have something that the public can access, and call it just a rudimentary dashboard, and it can be very manual. You don't have to have it, pretty like John Hopkins, where it's got like, at the, the data analytics built into like a web GUI, but something that easily shared, easily read, easily can be understood. And I think you can start off with just some basics informations, and then you can build it as you determine that data points are more relevant for people. As you might pick up another community that's saying, hey, we should be reporting this. Well, go ahead and add it to the next one. So I think it's my 2 cents there. I think that's important.
Pat?
Sure. Through the chair, Peter, when you want that type of data, what exactly are you looking for? As I was saying, I've been trying to break it out, by daycare age, school age, etc. Are you looking for it more by age, such as, the 20 to 29, 30 to 39, breaking it out that way? Or is it enough for you to have it school age and then, a 20-year span of adults? Or what, exactly what do you want, so we can start putting it together in a manner that's, meaningful to you? Most certainly, it is very helpful when you start seeing things broken out week by week, and analyzing it as far as percentages of, let's say, the percentage of cases in your school system or whatever, or other data points. It is much more meaningful. And that's one of the reasons I started doing that. Again, it is time consuming to do it, but again.
I agree. And I think everything we're doing is time consuming today. So by the way, I want to appreciate everyone's effort thus far. I know, a lot of the stuff is, kind of being done on the fly. I know we're taxed, we're tired, we're becoming extremely fatigued for the situation. So I want to be empathetic to that for all of you, all the staff members, even the volunteers and the board members who are working through this for the betterment of the public. I would comment on this, that what I want to see in terms of data is what you feel is effective that you would want the general public to know. So you look at the state dashboard, for example, and it's pretty, I mean, there's some really complex data points on there. And unless you really know what that is, I think you'd be scared to even just open a window, right? But I think there are some data points out there that I think are important that are, that I believe can help the community make an informed decision. And you're just providing information, you're not forcing them to read it, but it's something that talks about, what's been the 14-day period? Because yeah, I get it that someone was infected, positive 6 months ago. Is that really relevant today? Like, is that total number even relevant today? Like the 395, that's total in Grafton? Or is it the 76 over the past 14 days? Is that important to really know? And then what percentage of that has increased at a rate of what over X amount of days? So I can tell, like, oh, wow, this is really ramping up in Grafton. People are becoming more positive, and like they're getting tested and they're either becoming symptomatic or they came in contact with somebody symptomatic, or they become asymptomatic and they don't realize you're carrying it. So I think that for me, it would, be helpful, start with a basic data set that gives some rudimentary information. And I feel that as the Board of Health, and you're asking for our feedback, and this is just my subjective point of view, okay? I have no scientific way of backing up, but I do feel that having something that's centralized, that's on our webpage, that can be shared very easily through social media, something that's easily readable, viewed on I hate to say this, we all live by this. If you can't read it on a screen size this big, it's useless to the public. I'm sorry, right? So I think that those are some of the criteria, Patricia, that I can think of. And again, I did this in just a few minutes, but I would defer to your all's expertise about what information you believe is relevant for people to make a better informed decision and gauge how detailed does it have to be and how and how undetailed it has to. I don't know. That's my response, and I know it's not what you're looking for, but that's the best I can give you.
So Karyn Clark's hand is up.
Yeah, so so just so you know, we have one epidemiologist for 7 communities who has been working 7 days a week and is cracking. This is massive amounts of data, and the data is always moving behind the scenes because we have thousands of cases between the city and the towns. I think Pat's being incredibly generous, but I'm going to be a little bit of the mom here. We just don't have the capacity to get as granular, I think, as you'd like. I can tell you that we do share an age analysis breakdown every week with Grafton and all of the other towns, because that is important. And it's that one I don't think is too hard for our epi to do. And also it helps you kind of figure out where you need to target and messaging and so forth. We do get some data from the state epis who, I don't know how they're doing what they're doing. I don't think they sleep, but they do tend to send us information. I want to say, like, is it Wednesday nights? Maybe we get it tonight, Pat, or tomorrow morning. That does break down some of the analysis of, to your point, Peter, like how many people were tested actually in a 14-day period and sort of looking at positivity rates. So I think there's some stuff we can send you that's already put together. I think it's been a little high level that we're kind of like, do we share this with people? Are they going to understand it? I'm not even sure I totally understand it, especially 8 months of this. Everything's kind of a blur, but so I think what we could do is we can see what we have, we can share it with you guys, you can see what you think. And then if you have somebody who website stuff, then potentially maybe they could package this up for you guys in a way that you think would be helpful for the public to sort of synthesize. I just know, like, we literally, and I'm not whining, but like we're working 14 hours a day, like 7 days a week. So I'm just trying to be realistic about what we can offer you. And I know we want to give you this information to be helpful to people, but I just don't know how much we're able to do at this time.
I think I saw Colleen next.
So Peter, just to your point, to prepare for tonight, I did checked the numbers, and there's been 112 new cases in Grafton since the last time the two boards have discussed, since we've met since last week. And I like that idea of spreading that number on top of the daily case count. So Peter, if you don't mind, I can just each week keep track of the totals and tell you, and at the start of our meetings in your announcement, say there's been X amount of new cases in Grafton since last week.
I mean, Madam Chair, that's fantastic. Thank you, Ms. Roy, for offering to do that. Keep in mind that when we're reporting numbers and we're reporting data, we have to be, assured 100% that it's being, calculated and accurately displayed and disclosed, right? So in that case, I think it's more important for me where I can just go right from the town's webpage as well, from the Board of Health page, and say, here's today's. I'm just going to share that on my Facebook page, and I'm going to try to do what I can to, spread that word. And yes, you're right. We have a standing announcement at the select board meetings. We will be talking about COVID. We'll be talking about, municipal center operations. We're going to be doing that every single meeting, and we're going to be doing those announcements. But yeah, any information that you can send to me that can help, spread this out, spread the word, great. I know in our meetings, we only meet once a week typically, and this is rare. We're meeting twice this week, how do we do this on an everyday basis? And I think that's where I would also want to see some sort of centralization of this information where we can just go grab it at our leisure and also spread it on a daily basis. But you're absolutely right. It is something we should be talking about every select board meeting on that announcements.
Doreen, I think you were next.
Thank you, Madam Chair. Just a comment, which is very similar to what my colleagues are saying, which is for me personally, as a resident, not even as a board member, but I guess I'm receiving this information as a board member, the reminder, I'm a person who loves data, but it's not even the amount of data. For me, it's the reminder of what's going on and what the cases are and how they're staggering upward, that remind me of all the protocols in place and remind me, should I be going here? Do I need to go to this place? So I just think that, I think we all understand and appreciate how overwhelmed everybody is. And, perhaps less is more, that, if we just do something consistently for people, I think that is the most helpful. I think people want this information, but even a little information on a daily basis where they can go on a social media page, whatever it is. Again, as select board members, we can help with this and just help get data out into our community. As a reminder to people. And I understand some people, depending on where they work and what they do every day or how much they watch the news, may not want yet another reminder. But I think, again, for me, just getting Nancy's emails every day and looking at numbers and looking at just a small amount of data keeps it constant in my brain of, this is a priority, this is what's going on. I also want to comment that Dr. Muller, you said something striking that I wanted to comment on, which was, universal protocols or universal precautions. And I think that I can't agree with you more. And I think another thing we have to think about is, we represent or, the community of Grafton, but there's a reason why the Health Alliance was established, and COVID doesn't care about town borders or city borders. And there's an opportunity here for all of us to work as a larger community of central Massachusetts to say, if Kevin Mezikar and Kristen and Shrewsbury have made a decision doing this, that Grafton should take a look at it, Millbury should take a look at it, etc. And any way that we could help as a board to have more of that collaboration with this crisis, I think would be a good idea. And that's, working with our local Board of Health is just as important, but I think having, to get cases down in central Massachusetts, it would be smart of us to perhaps, meet as community leaders as to discuss, certain protocols that we can do entirely in central Massachusetts, and not just look at our town lines and say, okay, Grafton, we're in our little bubble, because that's not a reality. I mean, people leave to go to work, people leave to shop and come back to Grafton. So I just want to recognize that. And Dr. Muller, your wording kind of struck that in me. So thank you.
Dr. Muller?
Yeah, I would like to extend our gratitude to the Alliance. I've been on the board for a short period of time. I've worked in lots of different healthcare environments, but I think their contributions have been invaluable to us. And I don't think that we really have to ask you for any more data. I think what we really need to do is take some of the data you're already giving us and make it more publicly known.
Mhm.
I mean, I do think that the age distribution is certainly interesting. The fact that we've had such an uptick, we've had this since March, right? But in the last 3 weeks, I mean, we've, almost doubled the number of cases that in fact we had prior to that. Now, some of that is we're doing more testing, and some of that testing is being done and people are asymptomatic, but they can still be contagious. And until we understand that, I think people just don't understand that if, gee, I feel fine, I'm going to go do whatever I want to do. That's not going to get us where we need to go. So, but I do think the Alliance, I appreciate it's put you in a difficult position. And I think you've handled the challenge very well. And we're very appreciative of all the information that we get. So.
Thank you. Thanks to all of you for your support. It really, really means a lot. This has been like nothing we have ever experienced. And, some of us at the health department were a part of H1N1, and that looks like a cakewalk compared to this. So just want to really thank everybody for your support, and especially the Board of Selectmen joining forces. It really is going to take all of us. And so just really appreciate everybody rallying. And, we want to give you everything that you're looking for. I'm just being realistic. And I do think there is some good stuff. I think, to your point, we just need to figure out how do we package it up in sort of bite-sized pieces. I must want pizza because I didn't eat dinner. So I think, how do you take what we have and sort of package it up and make it meaningful and useful for people?
Great. Peter?
I just want to say thank you very much for having us out tonight. We appreciate you making changes to your schedule. I know we've got some things coming up that had some pending decisions and timing, and we really appreciate you indulging us and having a meeting kind of outside of your typical schedule. And I just want to say on behalf of the board and the town, thank you again for all of the work that you all are doing. Thank you very much. And if you feel at any point that we can be of any assistance, or you feel that there is another role that we may have not discussed or even overlooked tonight, please do not hesitate to reach out, and we can have that discussion at any time. Thank you.
Thank you. Thank you for coming out. Same thing. We're happy to, join your meetings on a regular basis, provide updates, collaborate, whatever. Hear your thoughts, ideas. So.
All right. Thank you. Have a good night.
Yep. Thanks.
Thanks.
Thank you.
All right. So next up, let me just pull up the agenda. Next up is Alliance updates.
So it's Karyn.
COVID?
So I think we just, what we just talked about for the last 2 hours is really the main thing. I sent out an update I think it was at the end of last week.
Yeah, I think Nancy sent it.
So if there's any specific questions from that, assuming you've all in your spare time have read it, I'm happy to answer, but otherwise it's all COVID. Pretty much.
Any questions from the board members at this point? All right, I'll take silence. All right, next up, flu clinic updates. Dan, I don't know, or Pat, since Nancy.
Sure, I have the flu
Well,
clinic update. All of your clinics have been completed for
Yay.
this year. We did 2 at the middle school and high school for each cohort. We had the elementary school clinic at North Street, the employee clinic, and made a couple of house calls and gave some homebound folks their flu vaccines. And we held the townwide clinic, which really didn't have a lot of attendees last week. Again, people, have been getting the message for months now saying, get your flu shot, get your flu shot. It's really important you get your flu shot. So a lot of people may have gotten it early on because of the messaging and whatever. But we did end up vaccinating 204 of your fellow citizens, which was great. Everything is in MIIS and everything has been billed out.
Perfect. Thank you for that. I know it was touch and go where it was like, we don't know when we're going to get the vaccine in the first place. Great.
Yes.
It's kind of hard. I felt so bad for Nancy, like can't schedule it because we don't know when
We
we're
don't
gonna
have, right.
or if we were going to get it in little small chunks, which was the other possibility.
Mhm.
So perfect. Thank you for everyone.
You're
that helped
welcome.
with those. Next topic on the agenda, let me pull up, is the Maven access for MRC volunteers. And I know, Pat, you're here for this, Marianne and Pam. I can kind of kick it off. There was at least an email that was received on our side from MHOA where it said that MRC volunteers can have access to Maven. Doesn't mean they have to, they're not required to, obviously, but there's the ability to. And that MRC would have to be authorized by the local boards of health to be on Maven, because then obviously those volunteers would have to be trained. There's a testing that goes along with it. And then there's requirements, and Pat, you can jump into this more because you know this way better than I do, around like what it means if someone in MRC wants to sign up to do this. So I think I'll turn it over to
All
Pat
right.
first.
All right, thank you very much, Karen. As you had alluded to, the MHOA did send out the memo saying that MRC volunteers could have access to Maven to help with contact, I should say with case investigation and contact tracing. One thing I will say with that, 2 things. Number one, it comes with a lot of responsibility. It is a HIPAA compliant task and investigation that you would be doing. The other thing is it is a commitment of time, as well as, not only time for training and to do the test itself, but also to do contact investigation. Just to do the basic case investigation can take 45 minutes, never mind the contact tracing within the person's immediate family, and then contact tracing out into their other community contacts or their employment contacts. So it can be very labor intensive. It can be very time intensive. That being said, for the Massachusetts Department of Public Health to do the 2 sessions of training and evaluate your proficiency test and get you up and running on Maven, there is an expectation that you will commit to do cases every day, and also to do a certain amount of cases. If you're going to say, oh, I can spare an hour or 2 and do 1 case once a week, that they're not going to go through all of that to get you on Maven for that little bit of a time commitment. The other thing is you may have if you get 4 cases assigned to you a day, there is an expectation that you will call those cases and attempt to make contact with them. So if they don't answer, you need to be willing and able to accept calls at odd hours. People may not call you, contacts and whatever may not call you back at the most opportune times. We take calls pretty much 12 hours a day and make calls 12 hours a day, nights, weekends, and holidays. So there is an expectation that you will make yourself available to do that. I'm not trying to dissuade you from doing it, but most certainly I want to make you aware that, just because you put a call out at 10 a.m. doesn't mean that that person's going to be available and call you back. They may not call you back till 7 o'clock at night, and you need to be willing to take that call at that hour.
Thank you. Mary Ann, since you're here representing MRC.
Yeah, hi, Karen.
Hi.
Pat, I do have a couple questions real quickly. Some of the MRC volunteers are nurses, either retired or current nurses. Would they already be MAVEN trained?
Not necessarily. The only people that really have access to MAVEN are the public health nurses and anyone who's right now doing contact tracing that has been trained up and assisting us. Some of the school nurses in some of the towns do have had MAVEN training and do have access to MAVEN and are assisting us with contact tracing. But in general, just because you have you're a licensed nurse in the Commonwealth does not mean that you have access to MAVEN.
Okay.
Or training in MAVEN.
Right. I could send out something to the MRC volunteers, specifically the ones who have a medical background, to start to see if there was an interest in them becoming trained in MAVEN and if they would be available, and see what response I get.
I mean, you most certainly can do that. I just, make them aware that this is a commitment of more than 1 hour, one time a week. If they're interested, they need to commit a chunk of time.
Sure.
Or to a number of cases per day. And that includes the case investigation and the contact investigation.
Because I know there's also a COVID-19 group in MRC. It's a COVID-19 group in MRC. I do know there's 27 MRC volunteers in this group of Greater Grafton that are on that COVID-19 group. I can reach out to them to see what response I get.
Okay, you most certainly can see what, I just wanted to make everyone aware that it is a time commitment, not only to the training, but also to the investigation.
How long do you think the training takes?
There are 2 training sessions. Again, it's been so long since I've taken them, and I know because they are training up so many people, they're trying to streamline it as much as possible. I did speak with Mass DPH to their MAVEN guru the other day, who is working 20 hours a day. And he said that they are trying to work with the BU School of Public Health to get an online training so that this could be accessed just as other Public Health Training Institute modules are available, but that is not ready yet. So they are doing trainings every Monday. So it's at least an hour and a half training. I think there's two groups of training, two sessions of trainings, and then they have a proficiency test that they're sent out, and then they get activated in MAVEN. The one thing I will caution people who may be interested in helping us with contact tracing and case investigation, your access in MAVEN is tracked by the state. They can tell me exactly what cases you have been in and what you have been doing. So, and we do track what cases we assign people who are working in MAVEN. If you are in a case that you are not assigned to, I most certainly will be notified of it, just to make people aware that checking on the neighbor next door who you think and suspect may be COVID positive, if you do that, you will be immediately terminated from MAVEN access. So, you really need to keep that in mind, that yes, it is trackable. Everything you do in MAVEN is trackable. So you know, we most certainly welcome the help because there are, you know, we've had thousands of cases. It just seems, last week I said to Karyn, we'll hit 10,000 by this past weekend. We're already well beyond that and into the 11,000 plus.
Right.
So we most certainly can use help.
Yeah, if the board will allow, I can definitely send out something through Mass Response and see what interest I get. And then get right back to you. Like I'll give them like a couple days or a week to respond and then come back with a number.
Okay, that would be helpful. We also, in addition to all of the training, we do have a contact tracing coordinator that was hired through our CDC Foundation grant, who also, once they are alive and up and running on Maven, does do their first couple of cases with them so that they don't feel like they're out in, they've been trained and they've never had any experience with them and they're being, you know, hung out to dry on their own.
Right.
So he is, you know, that's another part of the training also, and he works with them directly. So, you know, that he is there to be of assistance to them. And most certainly any of the public health nurses are available, but he's been working specifically with the contact tracers.
Great. Yeah, I definitely will send that out.
Dan, did you want to?
I don't think we really need a vote on this, do we? I think it's a pretty easy.
Well, if we're going to authorize, we need to vote. If we're going to authorize it, because that's what the ordinance says, if the MRC is authorized, so we would need to take a vote.
Oh, okay. Then I'd like to make a motion to authorize the Greater Grafton MRC to work with Maven and offer volunteers to Maven.
Right. Is there a second?
Second.
All right, and then roll call vote. Dan Finn.
Dan Finn, aye.
Josh Briggs.
Josh Briggs, aye.
Dr. Muller.
Bill Muller, aye.
And then Karyn Gwiazdowski-Govan, aye. So motion carried and passed.
Okay, thank you.
Thanks. Pam, did you want to I know you were part of this and been sitting through all of this. Did you want to say anything? Any questions?
No, I think it's just helpful on the cert side for Grafton, just to be aware of what's going on in the town, because we're ready to step in at any point and any time. So it is good for a knowledge base. What was just coming up about the Maven was, I couldn't help but think of all the people that aren't part of MRC that are just retired or not working at the moment, and the parameters of, you know, the awareness. I don't think a lot of people realize that Maven is out there. And yes, Pat, as far as there is a big commitment that goes with it, but I can't help but think there may be people sitting at home that are capable and willing to help and just unaware. You know what?
Agreed. Any other comments, anyone at this point? Yeah, Marianne, definitely let us know, you know, what the results are.
Yeah, absolutely. Absolutely.
All right. Well, thank you. If there's no other questions on that or comments, I think we're good with that, at least for now. So thank you very much. Next up, EDS drill and plan date. Dan?
Yep.
Okay.
Pretty quickly, I can just mention that I'm trying to pull together a conference call and or a Zoom a couple of weeks from now, just before Christmas, either the 21st or 22nd. And Dr. Muller, Bill Muller is able to make it, as well as Marianne and Pam. I'm waiting to hear from Jamie Terry, and I think I really got to get in touch with Alyssa from the Alliance, who would be the other key person, and just to meet each other and go through some basic information, and then to try to pick a date in the middle of January, maybe a Saturday, the 16th, if the high school is available, or whatever seems to be the best date for these folks involved. And so by our next meeting on the 28th, I'll have a little more information about, you know, pinning all that down.
All right. Sounds good. All right, the last topic on the agenda is annual license and permit renewals, which I know Nancy in her spare time has been working to get those sent out to the various business types that we have permits for. So think all the food establishments, septic haulers, wells, et cetera, et cetera, et cetera. So she's, they're late, obviously, due to all of the priorities with COVID that have been, coming fast and furious, but she's in the process of getting those out. We do have the larger question of how we're going to actually sign, permits remotely. But chances are we won't have a large amount back to us before the December 28th meeting. So we have time to figure out what the best process, maybe what others are doing within the town on how to handle that. Then all new business. I don't remember seeing any mail or correspondence come through outside of everything obviously COVID related that we've already touched upon. Upcoming meetings are December 28th, like we mentioned, January 11th, February 8th, and March 8th. Dan, you look like you want to say something.
Yeah, just back to new business for a second. I did mention about the teleconference or whatever with the Sunshine Sign folks. So we'll have more information. They're going to put together different proposals or one whole big package with some approximate pricing. And Nancy is going to look into the budget, what's left in the budget from the CARES Act funding. And so we'll may not have it together until the 28th, but there'll be more coming about that. There's some emails regarding that possibility. It sounds like a good idea if the funding's available.
Great.
That's all.
Right. Is there anything else from any of the other Board of Health members? No. All right. If that's the case, then I think we're through our agenda. Get a motion to adjourn. Someone?
Motion.
All right. Second.
I'll second that motion to adjourn.
All right, and then roll call vote. Dan Finn.
Aye.
Josh Briggs.
Aye.
Dr. Muller.
Aye.
And Karen Gwiazdowski-Govin, aye.